Hello masterminds, welcome back to today's class. The topic for today is depression, and we are going to discuss depression under the following subheadings. We are going to talk about the definition of depression, then we move on to the signs and symptoms of depression, and then we are going to end the video with the management of depression. You will want to stay with me till the end of this video because under the management of depression, I'll be talking about some lifestyle modifications that are backed by research evidence to be beneficial for individuals with depression. When people ordinarily say they are depressed, they are mostly referring to a normal human response to sad events or even unhappy thoughts. This loose use of the word depression can confuse us with the clinical meaning of depression. But strictly speaking, the word depression, as used by mental health professionals, is a psychiatric disorder that is characterized by pervasive alteration in the mood of an individual, during which the person experiences low mood or loss of pleasure in nearly all activities. It is important that we don't confuse depression with sadness, because sadness is a normal human response that is triggered by loss or a painful circumstance. Usually, the intensity of sadness is proportionate to the triggering event, and mostly, as soon as the trigger event ends, sadness also ends. But depression is a chronic or even a lifelong condition that continues to persist even after the trigger event has ended. Recent research on depression indicates that it affects about 3.8% of the global population, which makes it the second most common psychiatric disorder, just after anxiety disorders. Also, depression can occur at any age, but in most countries, it's more common in individuals in their 40s. Furthermore, among children, the prevalence of depression is equal in boys and in girls, but in adults, women are at least twice as likely as men to suffer from depression. Again, depression is more common in unmarried individuals than those that are married, and more common in individuals that are poor, unemployed, or with lower income. Now we are moving on to the signs and symptoms of depression. It is important to understand that the picture of depression varies from individual to individual, and it has more signs and symptoms other than sadness. In fact, the signs and symptoms of depression can be emotional, motivational, cognitive, physical, or even behavioral. Some people with depression express feelings of sadness and dejection, and some describe themselves as feeling miserable, empty, or humiliated. There is the loss of sense of humor, and affected people may experience little pleasure in life and activities they used to enjoy. In severe cases, there is something called anhedonia, which means the inability to feel any pleasure at all, or the loss of ability to feel pleasure. Some people can also experience crying spells, which are sudden and intense episodes of crying that are not provoked by any external trigger. Others too may experience anxiety, anger, irritability, or unprovoked agitation. Typically, individuals with depression hold extremely negative views about themselves, and they may end up blaming themselves for any unfortunate event that happens around them, even the ones that are not connected to them. In severe cases, there is delusion of guilt and feeling of helplessness and hopelessness that nothing will ever improve. Some may consider themselves as inadequate, undesirable, or inferior. And there is general reduced cognitive ability, which can manifest as feeling confused, unable to remember things, feeling easily distracted, and difficulty with basic problem solving. Some people with depression may lose their drive to pursue their usual activity, and in severe cases, there is paralysis of will, which indicates the lack of drive, initiative, and spontaneity. Affected individuals may end up forcing themselves to go to work, eat, talk to friends, or even engage in sexual activities with their partners. This may cause the loss of desire to stay alive, which ultimately leads to suicidal ideations. Strikingly, people with depression are generally less productive and less active. They may move more slowly and speak more slowly and spend more time alone. Some of them may feel difficulty falling asleep or difficulty getting out of bed even after waking up, leading them to spend more time in bed. Depression in some people can manifest as physical health symptoms such as headache, indigestion, constipation, lightheadedness or dizziness, general body pain, overeating or undereating, fatigue or anergia, that is, loss of energy, I think that is enough for the signs and symptoms of depression. We are moving on to the management of depression. Under the management of depression, we are going to talk about the use of psychological approaches, medical management, nursing interventions, and lifestyle modifications. Quickly, under the psychological approaches, there is the use of CBT, that is cognitive behavioral therapy, and psychology to manage individuals with depression. Research indicates that the gold standard for the treatment of depression is a combination of psychology and then medications. That brings us to the use of medical management in the treatment of depression. Under the medical management, there is the use of medications called antidepressants. These can be in the forms of TCAs, that is tricyclic antidepressants, SSRIs, that is selective serotonin reuptake inhibitors, MAOIs, that is monoamine oxidase inhibitors, and miscellaneous antidepressants. Examples of antidepressant medications are fluoxetine, paroxetine, amitriptyline, sertraline, citalopram, and escitalopram. Under the medical management, there is also the use of ECT, that is electroconvulsive therapy. That is when electrodes are applied to the head of an individual with depression to deliver electric shock to their brain as a means of managing depression. There is also vagal nerve stimulation and transcranial magnetic stimulation. Now onto the nursing management of individuals with depression. First and foremost, it is important to provide a safe ward environment and to continuously assess for the potential of suicide. This is because suicide or self-harming behavior is more common in individuals with depression than the ordinary population. Be especially aware of suicide risk after about 2 weeks of starting the individual on antidepressant medications, because these are crucial moments where the tendencies of suicide is at its highest. Also, be very mindful of increased suicide risk in the person with depression after a sudden change in presentation, such as sudden cheerfulness, or after an incident of violence and aggression. It is beneficial to spend time with a person, to be open, honest, and consistent with them. When engaging them in conversations, you have to ask open-ended questions, one at a time, and allow them time to answer. It helps to validate the person's feelings and verbalizations and avoid belittling what they are saying or feeling. Avoid saying things like everything is going to be fine or I know how you are feeling, because trust me, you don't know how they are feeling. And allow them to vent their feeling in whichever way is comfortable and safe, and offer support in such moments. Provide feedback in behaviors they engage in that contribute positively to their health, and provide support for maladaptive behaviors they engage in without being judgmental. Finally, it is important to promote rest and sleep and a well-balanced diet. We are going to end this video by talking about some lifestyle modifications that are proven by evidence to be beneficial for individuals with depression. We have physical exercise, active involvement in social activities, and spending quality time with people. Spending time with a pet, seeking social support, spending time in natural light and natural environments such as parks, getting optimum sleep, eating healthy, and staying well organized. This brings us to the end of today's lecture video. If you have any questions or if anything was unclear, please ask me a question in the comment section below and I'll do my best to answer these questions. Please like this video, subscribe to the channel, and share the video with others who will benefit from it. As usual, this is Masterminds Nursing. Ladies and gentlemen, class has ended.